Hello, Assalamu Alaikum. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. We are here today at Reliance Aesthetics, where we are going to talk to renowned plastic surgeon, Dr. Ayaz Uddin. We're going to talk to him about the do's and don'ts of aesthetic surgery and procedures and lots more information. So let's go and have a chat. Walaikum salam. How are you? I'm fine, thank you. Nice to meet you.
Thank you so much.
Where's Dr. Ayaz? Walaikum salam. I'm fine, thank you. How are you? Bilkul. Thank you so much for taking time out to see us today.
Thank you so much for obliging us with this presence.
Thank you. We are delighted to sit down with Dr. Ayaz Uddin, who is a plastic and cosmetic surgeon. Now, I'm sure when I've said that, you know, I've missed many areas of your expertise. I know you're very, very busy, mashallah, with lots of clients and happy people who are coming to you with good results. Please tell me as well a little introduction about the work you do.
Ma'am, it's my pleasure to have you here. And yes, I'm a plastic surgeon. Basically, when we talk of plastic surgery, it's a slang word in short. Plastic surgery, the full name that it carries is plastic reconstructive burn and hand surgeon. So I'm a cosmetic surgeon. I'm known for my aesthetics, basically. So that's it. And what else?
Right. So aesthetics, was this something you were always interested in? How did you find yourself, you know, coming into this area of expertise?
Actually, it's just something that I really had this passion for aesthetics right from the beginning. I had a few teachers who were very good plastic surgeons, and I used to follow their footsteps. And when I landed into plastic surgery training, that was total reconstruction. So after finishing that, I joined different ventures, different hospitals that I'd been working with. And from there, I started gathering more interest in aesthetics. As it evolved, as I got more into it, I was more like I just felt that it was something which I always wanted to be. And so that is why here I am today.
As they say, you know, if your job is your passion, then you really don't have to work, because it's something you love to do. And I think that really is something that helps a person in achieving the best results in anything they do.
I definitely agree with it, and I always say that you can never excel in anything unless and until you have the passion for it.
That's absolutely true.
Anybody, and even it's a message for everybody, that whichever field you pick or you want to be, you just need to have passion in that. If you don't have those passion and your interest in your field, you won't be growing, or you won't be going to the upper levels. You need to have something for that.
That's absolutely true.
That is what I really believe in.
That's so true.
So
one thing that we've noticed is that the huge popularity with getting aesthetic procedures. Botox was something we used to hear about, that people in Hollywood used to have done. Fillers, threads, all these things seem to come from distant places. Now they're readily available in Pakistan as well. This boom, how has it come about? What do you think are the factors that have added to it? And is this something recent, or is it just recently come to Pakistan?
Shabnam, these things and these procedures have been going on for a while. And if I talk of the media thing, if I talk sometimes back, when Instagram and Facebook and these gadgets were not much in public, people were lacking the knowledge of it. But now, since every girl you see or every boy you see is having the mobile in his hand with Instagram and Facebook and other apps working, so knowledge from all part of the world, it's accumulated here. And people see and they just want to go for it, the latest trends and latest everything that that they share, for example, some people would come down to me and they would say that I want the jawline of Angelina Jolie. And some come to me, they show me the pictures of the actresses that we want these lips. ठीक है? And so the main point is that now it is evolving. The people from Instagram, from Facebook, from different platforms, they are gathering knowledge, and they just want to be like that. Okay. And for your part, the question that now it has come to Pakistan, yes, it was there before, but people never had that knowledge of it before. Now it has evolved. Definitely, we are copying the West. So these procedures are pretty much common here now. And even on our part, we need to evolve too. If I talk of myself, I'm practicing in Pakistan and I'm also practicing in Dubai. So I follow both the cultures. So I'm getting both the information or latest knowledge from that part of the world too, and I'm doing my procedures here too. Because both follow different cultures, both have different requirements. Implants and those big lips are more common in Dubai side.
Right.
If we talk of Pakistan, our women, they want to stay natural.
Okay.
Okay, so that's the difference in different part of the world. But if you talk of the quality of things, if you talk of the best threads, best fillers, best Botox, or best procedures, everything is available in our part of the world.
Okay.
So
right.
We
will go further into what each of these things are. How do because so much of this is available now in Pakistan, as you have said. How much does a client have to research before they're going into getting some sort of procedure done? Because we do hear of people who come back saying, I went to so-and-so, or I went to this place and something happened, and they share stories again on Instagram or social media. So
here I would like to let you know, or even the whole viewers who are listening to it, that they need to do their homework, that which doctor are they going to? Is he a qualified specialist, a proper certified dermatologist, or a proper certified plastic surgeon that he's going to? Take care. Because if I talk of my region, this Pindi Islamabad, Rawalpindi and Islamabad, or even if I talk of whole Pakistan, there are about 60 to 70% of the people who have done just MBBS. Many are not even MBBS. They don't even have the basic MBBS medical knowledge of it, and they have just jumped into it, and they are doing the quackery.
That is so scary.
That is scary, and they are the people who just mess up things, and then that certain procedure gets defamed. Like,
exactly.
I'm not naming anything, but there are so many doctors in Islamabad, female, male, and they don't have any qualification.
Oh, that is really disturbing.
That is disturbing.
The face is something, the first thing that you worry about.
We are dealing with the human body.
Yeah.
Ultimately, it's us. Anything goes wrong, aesthetic is something which you are paying for.
Exactly.
This is not a disease. You want to be beautified, and that is why you are coming here. Okay? But in the end, if anything goes wrong, one fault is at the doctor's end, but one fault is yours. Why are you going for the cheaper products for a cheaper doctor?
Cheap, exactly. So that is a very important message that Dr. Ayaz is giving, that when you are going to get any procedure done, please research the doctor who's going to treat you. Are they properly qualified? And speak to people who've had some procedures from someone. Reputation is very, very important in this field.
Reputation is very important, but more than that, these days everybody has this Google or Instagram or apps. You can always check the credentials of the doctor before going there.
Right.
So, because if you're going to land up in the hands of a quack, the results will be what you can expect from that.
Yeah.
This is something which I wanted to always convey, and I would like all of you to be very, very cautious in selecting your injectors, because it is not a simple ball game just to have the filler in hand and inject. You have loads of vessels inside your face. You have so many other structures that need to be cared for. You need to know the anatomy, where you are injecting, how you are injecting. So if any Tom, Dick and Harry will come and would try to inject, that will land into blunders.
Yeah.
Yeah.
I follow you on Instagram, and I saw a post in which, and I thought that was very, very interesting. You had mentioned something about fillers,
Yeah.
and which part of the face to get fillers done in before you use the other part, because that would create an adverse effect. Please tell us about that. That was really interesting.
Actually, there are some tips and tricks for the fillers.
Okay.
This comes with the experience, obviously, that if somebody is filling, what I mentioned over there, that if somebody has this sunken or hollow cheeks, and they are filling in the under tear trough area,
Right.
so the filler from here is going to sink down.
Okay.
So if you want to hold the filler here, you need to give the patient some cheeks so that it can hold them up. If you want to have a jawline, you need to address the chin too, because if somebody has a recessed chin and they're giving a jawline, so a jawline will end here. If he or she does not have a proper chin, that will look bad. So similarly, if you need to raise the eyebrows, we need to inject Botox here, not here. Because these are the things which you need to understand, and obviously the best injector are the persons who are experienced in this. They'll be knowing everything about it. But for the new beings, the message actually, because I personally believe that if somebody does not know a procedure and he or she is doing the procedure, so I try to educate them so that they don't defame the procedure next time.
Yeah, yeah, exactly.
So
because
that is how it goes.
The same thing. People who don't know what they're doing are actually causing a negative impact on the people who do know what they're doing.
Like I'm giving you a very small example of our very famous actor Sajid Hassan. He had this hair transplant done in somewhere from Lahore or Karachi, and he landed into a mess with necrosis of the scalp. He was posting videos everywhere, but he did not mention from where did he get the procedure done and why did this happen. And now every patient who comes to me, every single patient for hair transplant, he comes to me with this, sir, wo jo Sajid Hassan ko hua tha wo to nahi ho jayega.
Of course.
So I always counsel them that you need to get certain blood tests done. You need to have, you need to be in safe hands.
Right.
And then when your doctor and you giving your history to him, that are you a chain smoker, are you an alcoholic, are you or you have been already gone to a quack for the procedure, if these things are not there, then you are in safe hands. You need to filter out things. आपको diabetes तो नहीं है, आपको sugar, blood pressure के अलावा कोई और atherosclerosis तो नहीं है, आपको कोई heart disease तो नहीं चल रही है, आपको कोई और problem तो नहीं है. क्योंकि अगर जब तक आपका proper doctor आपकी history नहीं जानेगा, उसको आपके बारे में नहीं पता होगा, तो वो आगे आपको treat कैसे करेगा. And these blunders, these mistakes happen when you're not in the safe hands.
Right. So you mentioned these underlying diseases as well.
Yeah,
these are very, very important to be checked out.
These are to be checked out because, and they can only be checked out when your doctor knows about them.
Exactly, exactly. That's how important it is. So another thing here is trust.
Yeah.
Immense trust that you're sort of going to a doctor who is going to be dealing with, you know, your appearance.
Obviously.
So exactly what you said, the research is very, very important. Okay, now fillers and threads and Botox.
Yeah.
For people who don't know, in layman terms, what is the difference and what do each of them actually do?
Okay, coming down to it, basically, if I start from the beginning so that people can understand what I'm telling about, facelift is of two types, whether it's a surgical thing or it's a non-surgical thing.
Okay.
In the surgical facelift, we give a scar in the preauricular area and we excise the extra skin, we lift the muscles and give the patient a youthful face. But that leaves a scar here. See, the perks about the surgical facelift is that it has this life of about 8 to 10 years. And the results are sustainable. But the Crohn's are, it leaves a scar here.
Okay.
So now coming down to the non-surgical side of the facelift or face sculpting, patients or my clients, they find it easy that they come on the as an open door patient, as a walk-in patient. They get the threads done, they get the fillers done, they get the Botox done, and they can have a lifted appearance for the certain period of time without any scar, without any bruise, or without any
major
complication.
surgery.
Yeah, and without any major surgery. So now coming down to what the threads are, what the fillers are, and what the Botox is. Basically, these three are different gadgets, but they work together, threads and needles. And threads, basically, they pull. If you are inserting threads, we are trying to lift the structures up. Take threads, pull. Talk of fillers, fillers fill. And when we talk of Botox, Botox freezes the muscle.
Okay.
Like if somebody comes to me and she asks that she has wrinkles on her forehead, she needs to raise the eyebrows. I'll be injecting Botox over there to address her issues, to address the wrinkles, to address, to lift the eyebrows. Because how do we lift the eyebrows? We paralyze this muscle, or we freeze this muscle, and we give power to this muscle. Because when this muscle gets weak, this muscle gets stronger, it raises your eyebrows. Okay, this is how the Botox works, right? And further going, now when a patient comes to me, like multiple patients come to me for different procedures, some they may just walk in, like if I talk of the young girls, they may come in to just get the lips done. Some come to me for like jawline augmentation. And if a woman of around within the bracket of 40 to 50 or 55 years of age comes to me, they would ask for a proper facelift. Or a non-surgical face sculpting. So how do we analyze the patient? How do, your question was that what products are used, or threads, what are the different functions of it? So then it's the duty of this doctor that where I come in, and I analyze the face properly, that if the cheeks have sunken, if the patient have pre-jowls, I'll be needing threads first to lift the structure. Then I'll be using fillers to fill in the spaces. Fillers are used to give high cheeks. They're used to address lazier labial line, the laugh lines, the marionette lines, or the sad smile. Then we can augment the lips or the nose with the fillers too. Non-surgical liquid rhinoplasty, which is the nose job. And similarly for the lips, a plumpish look or volumized lips, they can be beautifully delivered with the good fillers. And then the Botox, there are multiple uses of it. Botox is used to freeze these lines in the forehead. When you frown or you get lines over here, these are corrected with the Botox too. The crow's feet, they vanish with the Botox. Then many people come down to me for face slimming. So we inject Botox in the masseter muscle, and this slims the face. And then
because it relaxes the muscle?
It relaxes the muscle. It freezes this up your main muscle, which is the masseter here, and you get a V-shaped face or a slimmer face. But then again, it depends
on the patient,
on the selection of the patient too.
So this is basically an art.
This is an
art
that
you're working with. You're an artist working with different tools.
True, very true. This is an artwork. And then lastly, what Botox can do is that people get saggy neck. They have these prominent bands over here. So Botox is given to smoothen them out. And that helps them to get a youthful appearance or a neat neck.
Is there any limit to the amount of fillers and threads and Botox?
Yes, there is a limit to it, but the limit, it varies from person to person. Like many, if I talk of young women, from the bracket of around 20 to 35 years of age, even 1 or 2 fillers would work. They'll give the classy results which she desires. But if a woman comes to me with a very saggy face, and she needs her jowls to be corrected, her cheeks to be plumped, she needs fillers in the lips, she needs temples to be filled, she needs high cheeks and lifted face, then she'll need an amalgam of treatments. Like I'll be using multiple threads, I'll be using multiple fillers, I'll be using Botox too. And maybe I'll be jumping on to more than 100 units of Botox for that woman or the specific patient. So it varies from person to person. How we analyze the patient is like what the requirement is. Like if I'm putting in threads, I know how much lift I'm going to give or deliver to the specific patient. Like if I need to lift these up, jowls, I need to lift or correct the laugh line, or if I need to address the stat smile area or the marionette lines, at least 3 to 4 pairs are required in one sitting here.
Right.
And similarly, in the very same sitting, she'll be getting fillers to fill the spaces up, to fill the lines up, which are already there.
Right.
And many people, they come to me on a very late stage when they have already developed those lines which are already there now for a very long period of time, and they cannot be corrected with the fillers and threads. But they can be made better by putting in the filler or like and pulling it with the thread, so they can be made better with it.
Okay.
So the results vary from person to person. Selection of fillers or selection of threads varies from person to person, and obviously everything depends upon the type of filler and type of threads and we are buying and the patient is paying for. Like if I talk of threads first,
Right.
there are so many types in the market. If I'm talking of the super best threads, they are the Silvered Soft, the American one.
Okay.
Even the second best threads are Aptos, the Indian threads.
Okay.
And there is a huge line of threads, like 15 different types of threads in Aptos too. And then we come down to the Korean class of threads. So, जो Korean है, उसमें भी we have like 3 or 4 different types. The best of them are PLLA/PCL. Then we have PCL threads, we have PDO threads, we have just collagen threads. So every thread is different and the price of every thread is different too.
So you usually recommend a cost-effective.
That depends. Selection of thread depends. What structure are we planning to lift? What are we aiming for?
Right.
Like if you need to give it a major lift, the best threads are Aptos and Silvered Soft, the American one and the German one.
Right.
But if the patient is not affording and still we need to give
Wants
it a
to get
gentle
work
lift
done,
and then the work done, we can do the same work with the cheaper threads, which are the Korean version of it.
So can you get beauty on a budget?
Yeah, we can. But that depends upon
Because
your
many
pocket.
people sort of want to get the work done, but they think it's so expensive. So how do you deal with that? Do you ever get patients who say, you know, we want to have something done, but you know, we can't afford so much. So
actually, Shabnam, we are living in a third world country. We have all class of people here, and there are different stigmas women are going through. Even men, but I'm talking more of women because 99% of my clients are women.
Yeah.
For these face sculpting thing.
Right.
They come to me from all categories. Like some are poor, some are very rich, some are super rich. And the quality of products they are choosing depends upon their pocket.
Of course.
Like many people, they come to me and they just say, we don't want a second thing. We just want the top of the line threads, top of the line fillers, top of the line Botox. No second thing. And they pay for it. The second category is which mix up the things. Like in certain places they can afford good quality of threads while they go for the moderate or the cheaper fillers to merge their work up. And then there is the specific class who wants the work to be done. They're like on paid salary basis or whatever.
Of course, yeah.
And whatever the circumstances they have. And they still want it done. So they can go for the cheaper quality like in the Korean classes of fillers and threads.
Right.
So it can fit in all budgets, but it depends upon what you want. Like you can sit in a V8, you can drive a BMW, or you can drive a Corolla. This is you.
Yeah, yeah.
So you just pay for it.
And you need a good doctor to guide you.
Yeah, definitely.
Of course.
Definitely. Your injector matters a lot.
Yeah.
Because if you have a good injector, an educated one, an experienced one, then
they can give you the best results.
Yeah, definitely.
Is there any chance of this becoming an addiction?
It is an addiction. Yeah.
Because once you look good.
Because
once you look
good,
better than you do, then
many people they just ask me this question which you have just asked, and this always happened to me because many girls they come to me for the lip fillers and everything, and once they are done with the fillers, they just love it. And say after the time when the filler is dissolved or it's gone, and they come up to me again and they say, I want the same lips again. So it's addiction, because when you start living your new lips or new structure or new lifted face, so after a certain period of time, when the life of that filler or thread is gone, and then when you look back into the mirror, you're just like, nahi yaar, wo wala acha hai. So you just, and they just come back to me again. So here again, maybe I'm talking a lot, again.
That's what you're here for.
I'm actually
you're the expert.
Educating also on the same behalf. When we are choosing threads, fillers and Botox, with the quality, there is this certain things.
Right.
The top of the line fillers, or if I talk of threads first, top of the line threads, they last for 2 years.
Okay.
Top of the line fillers, they last for, the Juvederm, it lasts for 1 year and 3 months. But there is another filler with the name of Riaz. It is calcium hydroxyapatite. It is an irreversible filler. What is done is done. There is no reversal.
Okay.
In Juvederm and other fillers, if you don't like the results, or if there is something you want to come back, there is always an antidote for it to correct instantly. But if you're injecting Riaz, there is no coming back. It's done, it's done.
Okay.
And it has this life of around 3 years, roughly 2 to 3 years.
Right.
A Riaz filler. So coming down, Juvederm is lasts around 1 year, 3 months. Same goes for Restylane. And then if I talk about the Italian class or the Swiss class fillers, they last from 6 months to 9 months.
Right.
Like they have their peak around 6 months, and they start dissolving in about 9 months.
Different depending.
Similarly, if I talk of the Korean fillers, the Korean lasts for about 4 to 6 months. So the main thing is that if you're talking about the quality of filler or which filler to choose and what you're paying for, is totally dependent upon the quality of filler and the life of the filler too. And that is what you are paying for.
Right. Have you ever had a patient that you had to say no to?
Many.
Really?
Yeah.
How do you do that, and how do they take it?
Because
And what was the reason?
actually, this also depends. Even if I'm talking about today, just a few hours before your show, I had this beautiful patient. She's a very old patient of mine, and she has lost weight, and she is losing further, planning to lose further, and she just came to me for threads and fillers. So I said no to her right now because she's losing weight. If I'm going to put in threads and fillers today, when she'll be losing weight more, she has come down from 170 pounds to 150, and she's planning on to go to 130 or something.
Good for her.
So जब ये सब structure weight lose के साथ बैठेगा, तो threads और fillers अपना hold छोड़ देंगे, ठीक है? They'll come down.
Right.
तो जब वो नीचे आएगा तो she'll, मतलब in easy words, she'll be wasting her money.
Right.
So that is why I said no to her.
Okay.
Then there is another class of patients who don't need a procedure to be done, and they're just in a hype, like which I can say, like they have this inside their minds that we need to get this done because I've seen this on Instagram. This face, these lips look good on that certain girl, and I want the same lips on mine.
Right.
But no, she has a different face and you have a different face. No features of anybody that you're copying would look good on you.
Exactly.
We have to analyze your face. I lately had a patient, she's just 23 years of age. She came down to me that she wanted the laugh lines to be corrected. I did that, and then again she, after about 2 weeks again, she came again. I want them corrected more. I want a more pull. And I said no to her. No, it's not your age. It's not the right time to do it. And what I did before was because you just needed slight correction of it. But now it's not there. And overdoing of anything will give you a plastic look. A more stretched look, or something which won't look good. And then in the market, when that patient, they go in the market, they won't say that it was our fault that we wanted more. They'll say that the injector did it.
Exactly. So that's my next, you've just led me to the question that I've been wanting to ask ever since we just started this show. Look you get when you see someone and you just look at them and you think, oh my God, and they look artificial, and you can tell that they've had work done. Is that again from someone having that same desire to keep having procedures done, or have they just been in the wrong hands? What's happening there?
There are multiple factors to it.
Okay.
prime factor is that they must have gone to the wrong hands too.
No.
And the injector must have injected more filler, given in the wrong threads, or maybe more dose of Botox to freeze the structures or freeze the features too. Because when you can't smile, you can't move your structures, they look artificial.
Yeah.
ठीक. Secondly, it's sometimes the patient's faults too, because patients, they come up to us, they ask for it. They ask for more and more and more. Like many women or many girls would come up to me and they will ask for more plummish and overfilled lips. ठीक. So I'm going to deliver what they want, or the picture they are showing it to me, but maybe that won't look good on her certain face. ठीक है, and वहाँ से वो चीज़ फिर artificial look देना शुरू हो जाती है, which is overdone. ठीक है.
When you can tell straight away from lips, or you know,
anything
when a person, as you said, can't smile, and you can tell
when a person can't smile, he or she can't move her lips, or she's smiling with a fake look like this. So this means something wrong has happened. Or when there is overfilling, she may give this appearance of like a swollen face, or like sparked face. Without expressions, or a plastic look like overfilling of the laugh lines, which can give you like some, what can I say, that a totally unnatural appearance of the face.
What's the remedy for that? Have you had patients come to you who have had?
I have many patients coming here to me from different clinics for the corrective things done, and there are solutions to it. Like I mentioned, the fillers, if somebody has injected a calcium hydroxyapatite filler, which is a long-lasting irreversible filler, then nothing can be done. Then you have to wait for this 3 to 4 years. This specific period of time for that filler. But if the specific injector has injected a good filler or any hyaluronic acid-based filler, then we always have this antidote with us. It's called hyaluronidase, and we can always inject it and melt down the filler and bring the patient down back to the normal. However, Botox is not reversible. Botox has this life of 4 months, so you need to, what is done is done. So you need to wait for 4 months for that.
Right. So another thing I've been seeing on, we're constantly referring to Instagram, so social media has a huge part in this boom. You see people having drips or injections, and I can't remember the name. Is it
it's glutathione.
That's right. What's that?
It's basically a whitening agent, and there is a huge chunk of patients which come up to us for this whitening thing, because as I said earlier, we're copying the West. We want to be more fairer, and the stigma of our society.
And imagine they want to get tan.
They want to get tan, They go on to the beaches and they tan
They're spending so much money
and we want
to become like us.
Actually, many factors lie behind that. If I talk of the girls in our society, there is a big stigma.
The social pressures,
because the social pressures or whatever, because if I talk of the marriages and everything, so we just lack in every way, every possible way. People prefer white girls and everything out of the world, and
huge problem.
So, and other than that, following the Instagram and everything, and following the West, the class which is not just for this white thing, they just come for their booming, the professional booming of their like outlook. And people come up to me for that too. And then I have this huge line of celebrities because it's their rosy roti. So they come up to me for this. ठीक है, जिसमें वो whitening injections वगैरह लगा लेते हैं, and they carry it on so that their face can stay fresh, radiant, and it basically makes your color tone 2 or 3 tones down. ठीक है. The talk about
that's quite a lot.
Because glutathione, it's basically a we call it a whitening agent, but it's originally a lightening agent.
Is it harmful?
It is safe. It is FDA approved now. The story behind, I'll tell you the story, what really glutathione was and is. And the thing is that it makes your color complexion 2 or 3 tones down. Like if you have this concept in mind that if I'm going to inject glutathione on myself कि मैं गोरा बन जाऊंगा तो नहीं बनूंगा,
अच्छा,
ठीक है, मेरे यही कलर टोन 2 से 3 टोन्स डाउन हो जाएगा और मेरा रंग बेहतर लगेगा, लाइटर हो जाएगा, बिकॉज ये आपका मेलानिन काउंट, पिगमेंट काउंट को कम करता है, ठीक है। जब पिगमेंट आपका कम होगा तो उसके साथ आपका रंग साफ लगेगा, ठीक है। योर स्किन विल ग्लो, योर स्किन विल बी रेडिएंट। एंड इसके अलावा इसका जो एक बहुत बड़ा फ़ायदा है ग्लूटाथियोन का कि इट एक्ट्स लाइक अ मल्टीविटामिन, इट बूस्ट्स योर इम्यून सिस्टम। लाइक प्रीवियसली इन द कोविड एरा, जब कोविड पीक पे था, तो मेनी पीपल get this glutathione done, or not just for the whitening thing, because it is also a multivitamin drip too. तो वो whitening के अलावा आप उससे अपना immune system boost कर लेते हैं just to fight diseases. कि आपको अपना जब immune system अच्छा होगा तो you'll be able to fight COVID, you'll be able to fight multiple diseases which are based on your immune system too. ठीक है, ये तो खैर ये बातें थी। अब ग्लूटाथियोन था क्या, आया कैसे? बेसिकली ग्लूटाथियोन इज एन एंटी कैंसरस ड्रग, ठीक। जब शुरू में कैंसर के पेशेंट्स को ग्लूटाथियोन एज एन एंटी कैंसर ड्रग लगता था तो कुछ लोगों ने ये देखा कि इन लोगों का रंग गोरा होना शुरू हो गया, दे हैव बिकम फेयरर, ठीक है।
So they saw this as a side effect of
yeah,
that.
basically glutathione is what the whitening thing is a side effect of glutathione. Glutathione itself is an anti-cancerous agent, ठीक है, but it is FDA approved for humans now. It is safe, and it is because if a normal public is coming around for the glutathione thing and he or she is not a cancerous patient, we just get the liver function test before, because we need to see if the liver is functioning well or not. And if it is good, then the patient is good to go for the gluta.
Oh, right. So that explains that the other day I had the television on and I was watching this called one of those dramas that are very popular, and everybody was looking sort of the same tone, and I was thinking, is there some special light here? So you've solved one of the queries.
Well, that's glutathione as well as the filters.
As well as the filters. So what's happening to natural beauty? Is it a thing of the past? Will it come back?
Natural beauty is always there. The people who are blessed with the best skin and best features by God, they can never be altered by the fillers and threads. Fillers and threads can only sculpt your face with your features. We can just enhance your features. We cannot change your face.
Yeah.
So a woman or a man who's gifted with a beautiful radiant skin by Allah, that can never be replaced with glutathione or with any other filler.
And they shouldn't even try. I mean, they shouldn't try to jump on the bandwagon just because.
You just need to be realistic what you're going for.
Right.
Like if you have fake thing in your mind and you're just thinking unrealistically, then it's all in vain.
Right.
But you need to know that what I'm doing or what I'm going for, and this is my target, that I just want to make my features neat.
Right.
Then you're on the right track.
Right.
But if you are thinking, no, I'm doing this, मैं Katrina Kaif बन जाऊंगी या मैं Angelina Jolie बन जाऊंगी, तो ऐसा नहीं होता.
Crazy.
ठीक है, that's crazy. And मतलब इसी तरह.
Right. So, Dr. Ayaz, we wanted to, ask you to show us some procedures that are available here in your hospital. So let's have a look. I think it's a hydrofacial that you're going to show us.
Yeah, I'm going to show you the hydrofacial thing right now.
Right.
It's the most commonly done procedures these days. Talk of the town. Every next patient. It's the most safest too.
As well.
And
okay.
Basically,
and it's
people
pretty
used to go to
affordable
the
for
salon.
everyone.
It's affordable. It's cost effective.
Okay.
Patients used to go to the normal salons for the regular facials.
Yeah.
But now they come.
But I think those facials are sort of getting overtaken by these ones.
They are taken over. Taken over by
and
the
here as well, you're going to tell us the do's and don'ts of where to go and make sure you're getting the right. They have the right machine and everything.
Definitely.
So let's have a look then at that.
Okay.
Okay.
Thank you.
Okay, so we're here now in the where we are going to get a hydrofacial performed, and Dr. Ayaz, you are going to talk us through the procedure.
Oh yes, ma'am, definitely. Hydrofacial is basically a facial, but it is different from the saloon facials because इसके अंदर we suck out the oil ingredients and the dirt particles which are there in the pores, the open pores और जो pores के अंदर जो dirt फंस जाती है, we basically suck them out. ठीक है, then there is another part of it which is known as the scrubber part. Scrubber scrubs. Moreover, we remove the white heads, the blackheads from the nose, from the cheek areas and other areas of the body.
Right.
And then, but these are different. There are different serums which are spread around on the face, and they are used to cleanse the upper layer of the skin. Now the choice of the serum, it depends कि आपके patient की skin की type कैसी है.
Right.
अब कोई patient आता है sensitive skin के साथ, कोई oily skin based है, कोई acne prone skin है, कोई आता है mixed skin के साथ. So we have different serums for different patients. Right. And the choice of the serum, or the serum which you can see here in the machine, basically these serums are for different type of skin types. So if a patient comes to me with a normal skin, I'll be choosing the serum 1.
Okay.
If a patient comes to me for an oily or an acne prone skin, I'll be choosing the serum number 2.
Right.
I'll be choosing the serum number 3 for the sensitive skin, and which are highly sensitive because they have less content of the acid part of it or the extraction part of it. Serum number 4 is just basic. Okay. And so the choice, it definitely depends upon the skin of the patient.
Right.
And we
so
need
that
to
is
ask
the
the
most
patient
important step.
Yeah,
before getting a hydrofacial done.
Yeah, you need to tell which type of skin you have.
Right. How long does a hydrofacial usually last?
I normally recommend once a month.
Okay.
It's basically it's just a facial.
Yeah.
So you just have to have this in mind that if you're walking around or if you're going outside in any place, or like in the normal saloon facials which you regularly have, if they are done once a month, this can be done once a month. There is no laser involved in it. There is no skin breach, or there is no nothing जो skin damage करेगा.
Right.
So the main point is कि आप once a month करें, keep fresh, keep healthy.
Right. Great. Yeah. So what's happening first?
So now, coming down to the start of the procedure, here we have our main technician, Miss Marine, and she'll be starting the procedure. And from the very start, we are going to cleanse the face.
Okay.
And after cleansing, we are doing the gentle relaxing massage of it. And these are well-trained professionals there. Okay. And after the regular massage, there are certain pressure points on the face which gives the patient some relaxation. That relaxes the nerves. Okay. So
you get the human touch as well.
Yeah, yeah. Right. That is the first part of it.
Okay.
So when we come down to the second part, which is the machine based, and then there are approximately 8 to 9 different probes. Every probe has a different function. Right. Starting from the main thing, when I'll come down to the machine part of it, I'll be using the suction first. This suction is connected with this serum. So the serum comes out, it cleanses your skin. At the very same time, it is sucking out the dirt particles from your pores. The second part of it is the scrubber part of it. Okay. And with this blade scrubber, we scrub the superficial layer of the skin, and we are at the very same time removing the blackheads, the whiteheads, and the dirt sebum collection on the topmost layer of the skin. Then there are other parts of it too, like there is an ultrasonic probe, then there is a probe. This is an ultrasound for the face. It rejuvenates and it brings a glow on your face, and it opens up the blood capillaries so that more blood can flow in. Similarly, there is an ultrasound for the eyes. Then there is another probe, which is the cooling agent. Okay. As for the home remedies, like when you go to your home and you must have heard many people who are putting their faces in ice water just because to close their pores. So we are using the cold this gadget because since we are inserting the medicines over there too, serums too, and at the very same time we are addressing the pores with it. Right. So when we are going to add on this cold part over it, this is going to minimalize the pores and make the skin tighter.
And are those for the jaw?
These are the same things for the jaw. And in this very thing, this is just an air pressure thing, and we have the vitamin C serum here. So when we are done with the hydrofacial, we spray it over the face, and so that it can give a lasting glow. And further going the end of the procedure, the patient is asked to lie down with this light on. This is a multifunctional light with different purposes. It has a blue light, it has a green light, a red light. For some are for the bacteria, some are for the acne prone skin, some is for just for the glow thing. And in between we do the facials, and we have different type of masks which we are using, and the different vitamins and different vitamin C solutions and the mud mask, everything which rejuvenates your skin and gives life to your skin too. So this is how it's done. So right now we'll be requesting Madam Marine, and she'll be doing the procedure so that
so let's have a look then. Yeah. So we're finishing the hydrofacial now with the serum?
Yeah, we are finishing it with the vitamin C serum.
Okay.
And this is going to make the skin more healthier. And basically it's a multivitamin for the skin. And it will bring in the glow.
Okay. So that's the cherry on the cake.
Yeah, definitely.
Right, thank you so much.
See the patient smiling.
Oh yeah, she looks very happy with
happy.
it. Yeah, she looks very happy. I know, in fact, I think, you know, after watching this video, many people are going to come for a hydrofacial because it looks really good. So now that we've seen this, Dr. Ayaz, let's go and have you explain to us the different types of fillers, threads, and Botox as well.
Oh, sure.
Okay, so now we have moved over to see some of the products you were explaining earlier, the fillers, the injectables, the threads, the Botox.
Yes, Shabnam.
And so talk us through this a bit.
Actually, these are just the minimalistic of the fillers that I was talking about.
Okay.
But I just want to educate you as well as the public that what are the fillers and what are the different qualities. How do they need to select the best type of it, or according to their pocket. So if I talk of fillers first, this is the most long-lasting filler. The Radies, this is calcium hydroxyapatite.
The one you said can't be reversed.
This is irreversible. Once done is done. There is
and
no
that lasts
reversal.
about 3-4 years.
Yeah, almost about 3 years, plus minus.
Okay.
Then if you come down to the HA fillers or the hyaluronic acid based fillers, top of the line is Juvederm as well as this Restylane.
Okay.
They have this family which you Google it out, you go anywhere in the world, you'll find them on the #1 position as the best fillers in the world.
Nice.
Coming down, you have the Italian class of fillers, which can come with different names. Like I have this here with the name of Nuvia and Ifilla. They both are of the Italian range.
Okay.
And then further going, if you go down according to your pocket and selection of the fillers, then you can always go for the Korean class of fillers.
Right.
So this is the Korean filler.
Right.
And this is more cost effective as compared to the others. Further going, there is another class of filler which I didn't talk about before, but this has been awarded as the best filler in UK in 2019 as the best filler of the year. This is Profilio. The main function of Profilio is that it boosts up your collagen, it builds in the elastic tissue of your face, and it hydrates or moisturizes your face.
From within,
so
once it's
from within the setting
injected.
of it. It's injected once a month, and then it lasts, like if you're doing a procedure today, then the second setting will be after 30 days and it will last for 6 months.
Dr. Ayaz, thank you so much for taking out all the today. I know you are a very, very busy person.
It's my pleasure having you here.
It's been so helpful. All the advice that you have given us, I feel so informed, so I'm sure that the viewers at home have learnt so much. Before we end the program, your message for our viewers.
Message, Shabnam, the main message that I would like to convey here is that if you just go into the market, you will find so many cosmetic or aesthetic centers over there. You need to select your injector wisely. You need to see the qualification of your injector, whether he or she is a qualified person or not, whether he's a bluff or a quack. You need to check the reviews. You need to work upon Google, and if not on Google, because so many things are fake on Google too now, but open up your eyes, see what the other person is doing. Is he giving you the same product which you have paid for? Because this is also a thing that when you go up to an injector, he may charge you for Juvederm, whereas you must be getting a Korean filler. So you need to see your products too, what you are getting. So open up your eyes, select the best injector, work upon it. It's your skin, it's your face, it's your body. You need to take care of it rather than blaming others after it. So thank you.
Thank you so much, Dr. Ayaz. Very, very important message there. And for today, that's all we've got time for. We'll see you again next week. Stay healthy, stay wealthy. Bye-bye.